Good afternoon. My name is Frank Fitzpatrick, and this is a short presentation on the research project I did. The research project was on the association between short-chain, medium-chain, and polyunsaturated fatty acids with coronary heart disease in older adults among participants in the National Health and Nutrition Examination Surveys, better known as the NHANES. This research project was done for APN 755 Applied Nutrition Capstone class for the University of New England. The overall objective of this research project is to examine the association between individual fatty acids and the prevalence of coronary heart disease, congestive heart failure, heart attack, and cardiovascular disease-related mortality in older adults. So we'll be looking at individual fatty acids and their relationship to these 4 different coronary heart disease markers. The fatty acids we'll be looking at are the short-chain fatty acids, the medium-chain fatty acids, and the polyunsaturated fatty acids. The reason we're looking at coronary heart disease is because cardiovascular disease is a leading cause of death in the Western world. It accounts for 1/3 of all deaths in the United States. And coronary heart disease often involves atherosclerosis in the coronary arteries, which is a disease characterized by lipids and cholesterol buildup on the walls of the arteries. This is why we're looking at fats, dietary fats, and how they're associated with coronary heart disease. And this research aims to look at each individual fatty acid and its relationship to the 4 markers, which we'll be using are incidence of coronary heart disease, incidence of congestive heart failure, incidence of heart attack, and incidence of cardiovascular disease-related mortality. So understanding the role of each of these fatty acids plays in coronary heart disease will help give health professionals better understanding of the health benefits of the foods they are recommending. So why look at short-chain fatty acids? Well, most of the short-chain fatty acids that humans have are created in the colon by bacteria that convert fiber into short-chain fatty acids. It has been shown that high levels of short-chain fatty acids in the gut have improved blood pressure, atherosclerosis, and arterial compliance. Now, while most of the short-chain fatty acids are produced in the colon, butyric acid can be found in foods like butter, ghee, and olive oil. And it's also been shown that butyric acid supplementation can reduce blood pressure in diabetic patients. So this suggests that dietary butyric acid may also reduce blood pressure in the participants in this study. Medium-chain fatty acids are unique and different than the other fatty acids because they possess unique absorption and metabolic properties compared to these other fatty acids. When you consume medium-chain fatty acids, they are absorbed directly from the gut into the liver through the portal vein, and they don't rely on the typical membrane transporters to enter into cells, mitochondria. So medium-chain fatty acids are very efficient and used for energy rather than being stored. So even if there's high glucose present in the blood, which typically depresses the oxidation rate of all fats, it doesn't depress medium-chain fatty acids' ability to continue to be oxidized even when glucose levels are high. And this is quite unique. So this efficient metabolism of medium-chain fatty acids suggests they may play a very important role in human health. So this is one of the reasons we chose to look at medium-chain fatty acids. The next is polyunsaturated fatty acids. For decades, the advice is to increase polyunsaturated fatty acids and decrease saturated fatty acids for heart health. This has been supported by several studies showing that polyunsaturated fatty acids lower the risk of heart attack and heart disease deaths. Recently, 2 of the major studies, the Sydney Diet Heart Study and the Minnesota coronary survey were looked into again, and they redid some of the statistics on the data, and they said that it might be possible that these higher intakes of polyunsaturated fatty acids could actually increase the level of coronary heart disease mortality. This is one of the reasons we chose to look at coronary heart disease mortality in this study, since the studies are conflicting. Two of the polyunsaturated fatty acids that are frequently discussed in relationship to heart disease are the omega-3 and the omega-6 fatty acids. So we'll be looking at those. These are acids that have the first double bond on the third and sixth carbon atoms. That's why they're called omega-3 and omega-6. So while studies show that these are healthy fats to consume, there's also a lot of information out there that you should balance the ratio between your omega-3 and omega-6 fatty acids, since they both take up the same metabolic pathway, and the American diet is very high in omega-6 fatty acids, where it's not very high in omega-3 fatty acids. It's been theorized that the pathway gets completely consumed by the omega-6 fatty acids and doesn't allow much omega-3 fatty acid in. And while both of these are shown to be beneficial, you need both of them, not just one. We use the NHANES data, which has diet data, data on cardiovascular disease, descriptive data, and that's what we used. But then to get the mortality data, we had to go to CDC's linked mortality data sets. The CDC has all the mortality data linked up to the NHANES data sets. Since there was no personally identified variables, we didn't need the institutional board review approval. So once we had the data sets from 2013 and 2014, the other one from 2015 and 2016, and then from 2017 to 2018, we combined those data sets and we wound up with an NHANES data set from all the data from 2013 through 2018. Then once we had that, as I said before, we went and pulled the CDC's linked mortality data and then combined that in. So we not only had the descriptive variables, the diet variables, the cardiovascular disease variables, we also had the mortality variables all in one large data set. This study population was also reduced down to just looking at adults aged 50 and older. So then, once we had that large data set, the independent variables were grams of fatty acid consumed for each of the fatty acids listed there in the table. That would be all of the independent variables. And then the dependent variables were the outcomes of the cardiovascular disease measurements. So it was either yes or no for coronary heart disease, yes or no for congestive heart failure, yes or no for heart attack, and then yes or no for the cardiovascular disease-related mortality, which we got from the CDC. We also used the descriptive variables of BMI, gender, and race. So to do the analysis, we took the incidence of each of the conditions, as I said before, that was either yes or no to create the two groups, and then to assess the association between the fatty acids and these markers, we used a two-sample t-test. And these results were reported as counts, means, degrees of freedom, t-value, and p-value. And then any of the results that gave us significant results, we went and did the Cohen's d to measure the effect size. So here is the results from all of the t-tests that we performed. I'm going to show you the total results. It's a little hard to see since it's so much of it, but we took each of the fatty acids we talked about before, and we did a t-test against the 4 markers for cardiovascular disease, which were congestive heart failure, coronary heart disease, heart attack, and mortality from cardiovascular disease. And we measured if there was an association. And we did that for all these fatty acids. I'll close this out and we'll look at just the results which showed significance. So it turned out that there was 4 of the fatty acids which came out with significance, showing that they are good to consume for coronary heart disease, congestive heart failure, and heart attack, and death by cardiovascular disease. So if you see here, here's the 4 that showed significance: EPA, DHA, linolenic acid, and linoleic acid. Our research found that dietary linoleic acid, which is omega-6, found in canola, soybean, corn, and sunflower oil; linolenic acid, which is an omega-3, found in chia, perilla, and flax seeds, as well as green leafy vegetables; EPA and DHA, found in fish, fish oil, beef, and lamb, all significantly reduce the incidence of cardiovascular disease. Higher dietary linoleic acid was the only one that was associated with a lower incidence of cardiovascular disease-related mortality. It was also interesting that EPA and DHA, with a mean consumption of only 0.025 grams and 0.061 grams, respectively, were significantly associated with the reduction of cardiovascular disease at such small quantities. The strength of this research project was the use of high-quality dietary intake data along with cardiovascular disease data from well-designed survey, NHANES, and the CDC. So these findings could be translated to the general adult U.S. population. Limitations: the study only assesses the association between the incidence of cardiovascular disease and each of these fatty acids. It doesn't attempt to tell the optimal amount. That would have to be done with further research. Other further research that could be done is the NHANES data sets go all the way back to 1999. If we would bring the data all the way back to 1999, and also as for future years come on board, add future years to the data set, the linked mortality data would become more and more beneficial, since, as the populations age, there's more people who are passing away, and the data will become a lot stronger. Well, thank you for listening to my presentation, and the next page is the references.